Good afternoon, everyone. Thank you so much for joining another one of our live Q&A sessions. Today I'm going to be joined by Dr. Robina Coker, and she is going to be answering all of your questions around COVID, lockdown and shielding. We've had a lot of questions sent in, so we'll be going through those. And if you would like anything more answered during the live stream, then do comment them down in the comments section below. We'll be sifting through those and trying to get through as many as we can. Firstly, I'd like to start off by just introducing myself. I am Charlene Pink, as you can see, the Marketing and Fundraising Executive for SarcoidosisUK. I've been fortunate enough to be with the charity for around 2 months now, and I'm thoroughly enjoying the role so far. It's great to be part of the sarcoidosis community, and really excited to be looking at ways that we can kind of support you all and be part of the community and raising more funds for sarcoidosis. On that note, I'd like to start off by just saying that at the moment, obviously because of COVID, the entire charity sector has been struggling, and we are experiencing the same. Unfortunately, we can't host any of our usual events, so we're having to look for other means to be getting funds in at the moment to continue doing our vital work. And one of the main ways that we can do that is by your personal donations. So if you're watching this video and you are able to contribute in any way, we thoroughly appreciate it. The link will be down below in the comments directly to our webpage where you can donate to sarcoidosis. Any amount would be really, truly appreciated, and it would mean that we can continue doing our vital work, which is around research in sarcoidosis, raising awareness through Q&As like these, and supporting those living with the condition. So that's a little introduction from me. Thank you very much, be thoroughly appreciated. And without further ado, I'd like to introduce Dr. Robina Coker. Thank you so much for joining us, Dr. Coker. How are you?
Hi, very well, thank you, Charlene. Thank you for inviting me.
Oh, thank you for having us. We're absolutely privileged to be able to have you here today with us. Just a little introduction on Robina. She really is the best person that we could be speaking to today about the new COVID shielding measures. So she is a consultant in respiratory medicine at Hammersmith Hospital, and Dr. Coker has run the sarcoidosis service at Hammersmith Hospital since 1999. It's actually one of the largest groups of sarcoidosis patients in the country. So very impressive with that. In addition to her work as consultant and honorary senior lecturer in respiratory medicine, she's been clinical director of the NIHR Clinical Research Network in Northwest London, and that's since it was established in April 2014. So as I said, we're extremely grateful to have her join us today, and really is truly the best person to be answering these questions. So thank you, Robina.
Thank you, Charlene.
So without further ado, as I said, we're going to be going through the questions that have been sent in already, and then going through onto some questions that have been sent in during the live streaming. So do comment them down below if you'd like anything answered. But we'll start off just by obviously discussing the new measures that have come in place. As everyone knows, we're in a national lockdown, but in addition to that, on Wednesday evening, the government did announce that vulnerable people have gone back into shielding. So that's the latest update, and obviously we've had lots of questions around that, and everyone would like some clarity because I think there's some confusion for people with sarcoidosis whether they're included in that and whether they should be shielding or not. So from your point of view, Robina, just from your understanding, people with sarcoidosis, are they all going to be included in these shielding measures?
No, my understanding is that people who are immunosuppressed, so are taking medication to suppress their immune system, which will include some, but not all sarcoidosis patients, and patients with severe lung disease or cardiac disease would be classed as clinically extremely vulnerable and would be advised to follow additional measures above those that the rest of us are being asked to follow, so the hands, face space that we've all become very familiar with. And as you know, I'm sure sarcoidosis is such a variable condition. It can affect so many different parts of the body that it's really very difficult to say there's a one-size-fits-all approach. And the new government advice does allow for clinician discretion in deciding whether somebody is clinically extremely vulnerable. And I would encourage anyone who is concerned about that or confused to have a chat with their specialist. Because they're the best placed person to advise on whether they fall into that clinically extremely vulnerable group.
Of course, yes, thank you. So, as you kind of said, sarcoidosis, it can affect people in different ways, which kind of leads nicely onto another question. Some people have been saying that they have received letters and then others haven't. Is that kind of down to the fact that some people may be on that vulnerable list if their sarcoidosis affects their lungs, for example, because they'd be more severely impacted if they were to catch COVID?
Yes, I think that's correct. And it will depend probably on the state of their records back in February, March of this year. Not everybody's records will have been updated, so there may have been some changes in conditions since then. So yes, absolutely. And I think if you've had a letter and you're not sure whether it still applies to you, then absolutely contact your specialist. If you haven't had a letter and you think, actually, I think I should have had a letter, then I think it's worth contacting either your general practitioner or your specialist just to say, what's the situation?
Of course, yes. I think, yes, that's definitely good advice to highlight. If you haven't received a letter and you are confused, to talk to your medical consultant. Of course, they're the ones who know your full medical history and should hopefully be able to advise further on that. So just in terms of people who haven't received a letter, then I know that we've had a lot of feedback saying that people are waiting for quite a while for their GPs or medical consultants to come back to them, and they might be having to go into work at the moment while they haven't got their letter. In that situation, is it best for them to have a conversation with their employer and just highlight again the condition and just kind of stress the fact that they should be shielding?
Yes, I think so. I would hope that most employers now are fairly appraised of the situation. It's not like the situation in March where it really was very new for everybody. We've all been playing this game for some months now. So I think most employers are aware and most employers are sympathetic. And many employers, of course, will also have an occupational health department, and it may be worth having a chat with them if appropriate. So yes, I would hope that will sort out most of the problems in that regard.
Okay, yes. So it's we just need to highlight as well, it's definitely of the position that someone who is on the shielding list should not be going to work at the moment. Obviously, if you're able to work from home, then do so. But if that's not possible, we're definitely of the position you should not be going in. Is that correct?
Yes, that is correct. Yes.
And that is all outlined on the www.gov.uk website, which we have reposted to our Sarcoidosis UK Facebook page. You can find it pinned right to the top. So if you do want to read the government guidance straight from the website, you can do so by following the link on our Facebook page. Brilliant. So we've had a question from someone who phoned in to the charity a couple of days ago and talked about their sarcoidosis being in remission. So they haven't been affected for it for years. Obviously, we are aware that sarcoidosis could have flare-ups, so she was conscious of that. But at the moment, it's not affecting her in any way, and it hasn't been for several years. Would you suggest then that someone like that should be shielding?
That's such a difficult question. Obviously, I'm not going to take the place of that particular person's specialist. So, they should talk to them if they're still under specialist care. But as you know, many people with sarcoidosis stay in remission and can stay in remission either for many years or indefinitely. And it would be very bad luck if it flared during a pandemic. It might, of course, because you never know. And stress, of course, can make these things worse. But there's no reason to think that for it particularly to flare. So if they're very well, I would hope that by following all the usual precautions, provided if they really can't work from home, if their workplace is COVID secure and their employers made the efforts to arrange that, then I would have thought that they should be able to go to work, but follow all the precautions that everybody else is being advised to follow.
Of course, yes. So as you stated, it's just really important that we, whether your class is clinically extremely vulnerable or not, that we all do keep following these guidance set out, and they're in place for a reason, and hopefully that will, put us right on the path to kind of getting over this in the future. So yeah, that's we've had those questions that have been sent in before, and then we've also had some people comment that are watching live. So thank you so much for joining in. Paul from Facebook has kind of put a note along the same kind of note saying, can I return to work with pulmonary sarcoidosis? Their occupational health will not allow this. They say the condition's too unpredictable. So in that case, would you say that it is best for them to be shielding?
Yes, I think so. I think if that's what their employer has said, it sounds as though their employer is supportive and sympathetic. And if you have significant lung disease, you will be at greater risk. If you're also immunosuppressed, then you're at additional risk. So yes, I think if you possibly can, work from home or not return to work.
Yes, of course. So as you mentioned, there's some, if you're on immunosuppressant, and kind of different medications will have different effects as well. Michaela is watching live. Thank you for joining, Michaela. And she asks, would hydrocortisone tablets mean that shielding is required? She hasn't been told anything as of yet, and the tablets are for adrenal insufficiency, not our sarcoid treatment.
Yes, that hydrocortisone, my understanding is that hydrocortisone replacement is in such low dose, it's there, as she says, just to replace the normal adrenal function, and therefore that shouldn't be a problem. But I think, again, if there's any doubt, contact your specialist just to get their input on that.
Brilliant, thank you. So we've also understandably had a lot of questions come in around the new vaccine news. So as we would have all seen on the news, we've kind of got very promising hopes of a vaccine being introduced very soon. The UK has kind of got some bulk order batch waiting, just kind of going through those last approval stages. So we've just had some questions around that vaccine really, and people wondering what that vaccine will mean for people who do have sarcoidosis and are classed as clinically extremely vulnerable. So Sheila asked, will the new vaccine be viable for sarcoidosis sufferers, as our immune systems are already in overdrive and the vaccine works on increasing immune systems?
Sure, I mean, it's a very good question. And there are still a lot of unanswered questions about the vaccine. We don't have all the data published yet, and we haven't quite got all the safety data. So there's a little way to go. But I just remind everyone that we normally do recommend that people with sarcoidosis have the seasonal flu vaccine. And that doesn't normally present a problem. And in fact, it may be with some autoimmune conditions that there is less of a response to flu vaccination than in normal controls. It depends a little bit on the condition. And there aren't a lot of data in sarcoid, but there's no reason to think that COVID-19 vaccines might not be suitable for patients with sarcoidosis. At the moment, obviously, we've got quite limited data.
Yes, of course. I think that's the thing. We're delving into the unknown a bit, really, isn't it? Of course, there've been hundreds of vaccine made previously, which we can kind of base our assumptions off. But until the drug is actually here and in use, it's quite difficult to judge, isn't it, at this current stage? But just from your medical point of view, people who are on immunosuppressants, do you think they'd be kind of in a different category? Would you think the vaccine would affect them more severely than someone who was not?
Yeah, so we normally recommend that people who are on immunosuppression don't have live vaccines. You're probably familiar with that. The obvious one, for instance, is yellow fever. So we don't recommend that people who are immunosuppressed have yellow fever vaccination. So it is something that needs to be discussed before considering vaccination. Now, we haven't got any live COVID vaccines that I'm aware of at the moment. The mRNA technology is very interesting. So the Pfizer vaccine uses mRNA to stimulate the body to produce a little bit of protein that mimics viral protein and thereby stimulate an immune response. And my understanding, and I'm not an immunologist, but my understanding is it's the first time that technology has been used in vaccine production. So it's very interesting and very exciting. It is new technology. So I think we just probably need a few more weeks and a little more data just to see how that's going to pan out. But it's not a live vaccine. So it's not one of the vaccines we would normally say was unsuitable for people who were immunosuppressed.
Okay, yeah. So yeah, unfortunately, it is a bit of just a waiting game, isn't it, until we kind of find out more and get those results in. Yeah, completely understandable. Teresa asked, she noted that the vaccine that's being developed by Pfizer uses T cells. Teresa says, I read some time ago about sarcoid research that asked whether T cells were in some way responsible for sarcoidosis. Could there be any implications from the use of T cells in this vaccine for sarcoidosis sufferers?
Yes, it's a very good question. And the thing is that there are lots of different types of T cells. And there are a specific subgroup of T cells that are involved in the inflammatory response in sarcoidosis. And the vaccine will be stimulating a different specific subset of T cells to react to the viral protein. So I don't think you can extrapolate. They're different responses.
Okay, yeah. And do you think with the vaccine, obviously this might be something again that we just need to wait and see, but do you think sarcoidosis patients and possibly other people who are classed as clinically extremely vulnerable, do you think that they're going to be given priority for this vaccination?
Yes, well, my knowledge on this, Charlene, is probably much the same as yours from watching Chris Whitty talk about this. So my understanding is it will be age dependent to start with. So they're going to start with the very elderly and the frail and those in care homes, residential homes, and possibly the care workers looking after them, so that they are protected. And then I understand the plan is to move down the age groups and the clinically extremely vulnerable groups. Now, quite how they're going to do that, I don't know, because I think we have enough to vaccinate something like 20 million. But remember, you have to have 2 doses of this vaccine. So whatever it is the UK government's purchased, we only have half effectively. So younger people with mild sarcoidosis may not in fact be invited to take part at this stage. I would expect it was people with more severe lung or heart disease or on high doses of immunosuppression, possibly older patients who would be higher up that priority list.
Okay, yeah, of course, and it's kind of another one of those things as it goes along. Obviously, I'm assuming the government will be ordering more, but it will have to be assessed as who is given that priority. And as you said, at the minute, as far as we understand, will be done kind of by age brackets and people who are in need of it most. So Mike has put in a live question. Thank you, Mike, for joining. He's asked on through our Facebook comments, do you think that GPs will have the infrastructure, including the freezers, to store and to deliver the vaccine? Because as we know, it has to be stored at incredibly low temperatures, doesn't it?
Yes, that's also a very good question. So I was discussing this with 1 or 2 people last night, actually. So you have to keep it at -80, which is a temperature that most of our domestic freezers do not, well, none of our domestic freezers reach. You only normally get -80 degree freezers in laboratories. And as I understand it, it's only allowed something like, well, it's only a few, 3 to 5 times out of that temperature before it reaches the patient. So it really has got to be protected all the way. And I would imagine that what they're looking at, and I know that the government have consulted a number of organizations, including the military, to look at the logistics of this. I imagine what they're looking at is some kind of mobile -80 freezer hub arrangements, and that then the vaccine can then be distributed from those hubs to the patients. I can't see every GP surgery up and down the country acquiring a -80 degree freezer. I don't think that's how it'll be done. And it may be that people will have to travel to a different centre for their vaccination. But I haven't seen any details yet, and I don't want to preempt all the plans that are going on in the background.
No, of course. No, thank you for answering as best you can. Obviously, it's going to be, I'm sure, a challenge, but we'll be staying tuned to see the latest as that vaccine develops. So in terms of your patients, would you personally be advising them, even if they weren't necessarily classed as clinically extremely vulnerable further down the line, once there's more availability of the vaccine, would you be encouraging people then in the future to be getting that vaccine as kind of a precaution?
Sure. I mean, I think depending on the safety data, depending on our experience at that stage, and depending what other vaccines are available by then, in principle, I support vaccination. I think it's desperately important. We need some way to get us out of repeated cycles of lockdowns and releasing lockdowns, because it's the effect on the economy and all our mental health is extreme. So we have to find a way out of this, and vaccination is definitely part of that solution. So yes, in principle, I would hope that in the next few months we would have more data, we would have potentially more vaccine candidates, and we'd be better informed on the best vaccine for different groups, as happens now for the seasonal influenza vaccine.
Yeah, of course. Brilliant. So we might have a few more vaccination questions come in as we go through the live stream. But for now, we're just going to kind of jump back again to people, and some people have sent in their own experiences at the moment, and some of their questions that they'd like answered just around the shielding again. So obviously the first time with lockdown, we know that the government and the NHS, they kind of compiled this shielding list and might have acted on the side of caution in terms of including people who might not actually need to be on this list, because obviously we knew a lot less about the virus. We didn't know how it would impact people with different kind of diseases, and as I said, yes, possibly they just acted on the side of caution in getting more people on the list, because rather have more people shielding than kind of miss out on certain diseases and put them at risk. So this time round then, would you say if people haven't received their letter that it actually might be due to the fact that we just have an enhanced understanding that they might not actually need to be shielding, regardless of the fact they were the first time?
Well, it might well be, but I wouldn't make that assumption.
Yeah.
We know that letters sometimes go astray in the post. We know that computers and systems are not perfect. So if you have, significant lung or heart disease, or even neurosarcoidosis, and you're on medication for that, and you're under regular specialist care, then I think if you haven't received a letter, by all means, have a word with your GP, have a word with your specialist, just check that you haven't been missed off that list by mistake.
Of course, yes. So, and then that kind of leads on to the topic of people who have been asked to shield, but they have children, for example, who kind of, the schools are still open, as we know, and the position on that is the government saying that it's still all right for children to be able to go to school if a parent or someone else in the household is on the shielding list.
It's very difficult, and I've had to advise a few families in this situation. We just know that the harm to children of not going to school is really significant, and the government, as you know, is very keen to protect children, their education, their development, their social interactions, and so on. So schools are remaining open at the expense of many other facilities that are now closed. And it is, as you say, very difficult. Now, most schools, I believe, are working really hard to keep children in their bubbles, their small groups. They're being very careful about that. But obviously there is an increased risk as soon as you allow children to mix outside their household, and that's just inevitable. So I think what you do then depends on your own approach to risk, your own condition, and the facilities that you have at your disposal. So I know some families where children come home, change their clothes are washed, they change into clean clothes, they wash, and they have very little contact with their clinically extremely vulnerable parent. Maybe they don't eat their meals together, they bath and wash at a separate time. That all depends on the age of the child. It depends who else is there in the household to help, and it depends on the understanding of the child, and how easy it is for everybody to do that, and how much space you've got. So I think people just have to look at what they can do and what they feel comfortable with in the circumstances. I don't think there's a one-size-fits-all approach. It would be very much easier if there were. I think it's very difficult.
Of course, I think that's one of the key takeaways, isn't it, from a lot of the questions that we've had in, and we need to emphasise there isn't a one-size-fits-all. Everyone can be impacted differently, whether that's if you're included on shielding or not, because of the way that sarcoidosis impacts you. And yeah, once again, just stressing that it's important to speak to your medical consultant if you do have any kind of concerns. Of course, always better to act on the side of caution, but it's very difficult to kind of put that blanket over everyone saying this applies to the whole group when it's just not the case, is it? So obviously, in terms of then interacting with others in the household, the government website currently says that if possible to try and maintain distance 2 meters from other people in your household if possible. Do you see this kind of being something that's going to be sticking around for the foreseeable future? Obviously, the shielding is expected to just go on until the 2nd of December that they've said, but is there kind of a possibility of this being extended, and what impact could that have on people who are being asked to shield?
It's very difficult, isn't it, Charlene? I mean, I think the government was desperate to get us all into lockdown so that we might have a bit of respite over Christmas and the New Year, when obviously families like to get together, and it's a very important time for families. I mean, the numbers seem to be relatively encouraging, so one could be cautiously optimistic. I rather doubt it will be the only lockdown before the spring. You could envisage a situation where we have a partial release before Christmas and the New Year, and then we're obliged to all go back again. I don't know. It may be that the vaccines will start to come on stream and make a difference, and we hope that they do, but there are a lot of unanswered questions. We don't know whether they stop people carrying the virus who have no symptoms. We don't know if they prevent severe cases, and we don't know how long the immune response lasts. So it is very tricky. I think it's best on the whole to prepare to be prepared mentally to do this for longer if necessary, rather than pinning one's hopes on early December for an end. I think it's better to be realistic. If you know you're in it for the longer haul, or you may be in it for the longer haul, you may be able to manage expectations and actually say, what can I cope with realistically for 12 weeks on and off over the winter, when the days are shorter and it's often wet and it's colder, and it's not as easy to meet people in the garden or outdoors. It's just difficult. It's just not as easy as in the spring and the summer when we had fantastic weather. So I think it's also about, just managing one's own expectations and just being realistic.
No, of course. I think that's a very, very important thing to highlight, is just obviously lockdown really can impact people in many different ways, and mental health is one of those ways that it can have a really detrimental effect if people kind of aren't able to socialise with others or communicate effectively. So if you do feel like you are struggling, we have got some resources available on the SarcoidosisUK website. Please do head over there and look at the support sections. We've got some really useful links to other services that can help you if you're struggling with kind of mental health, or just need someone to talk to during this time, because it can have an impact. I know myself, and probably you as well, we've all probably experienced it, that being locked inside, it does have an impact, doesn't it? And it's important to remember during these times to keep speaking to people and keep that communication going even when we can't see people in person. I think it's really important. Thank you. So just in terms of then people who are shielding, do you think that there might be a risk that their immune systems might become lazy as such, or kind of not be able to cope with some other challenges that might be thrown their way in terms of other diseases and things, if they're staying inside for prolonged periods of time and aren't exposed to those everyday germs as such? Do you think that could have an impact on their immune system and their ability to cope?
I wouldn't have thought so, because in the life of an individual, it's a relatively short period, and you will have already during the course of your lifetime built up some immune system memory, if you like. One of the benefits actually of lockdown that we've seen, and we've seen this not only in sarcoidosis but also in patients with other lung diseases such as asthma and COPD and bronchiectasis, is that people are getting fewer lower respiratory tract infections and requiring fewer antibiotics, and that's a really positive outcome. So no, I don't see any adverse effects from that.
Okay, fabulous. Yeah, it's nice to look at the positives, which actually leads us on to our next question. We've had a question come in from Stuart, who's watching live. Thank you so much for joining. And he says, do you feel that the amount of scientists looking at the immune system and T-cell response, and that there may actually be a benefit to conditions such as sarcoidosis in the future? Never before have so many experts looked at the immune system, albeit in reaction to COVID at the moment, but could that actually have some implications for us in the future or other immune diseases?
Yes, I would hope so. I think that's absolutely right. It has stimulated interest in the immune response in a way that perhaps that nothing else has in the last 100 years. I think the other really positive thing is that, and it's not positive for the sufferers, but it might be positive for sarcoidosis, is that this new phenomenon of long COVID, with a whole host of different symptoms, but particularly this very severe, what appears to be a post-viral chronic fatigue syndrome, for want of a better term or description. We're developing ways of addressing that in a very multi-professional, multidisciplinary way. And I would hope that longer term, that might give us help for sufferers from similar symptoms with sarcoidosis, because it's always concerned me that we don't have very good resources for people with chronic fatigue and some of these other very ill-defined symptoms. And it might just be the fact that we have now a cohort of people, unfortunately, with long COVID, and we're having to address some of these, might mean there are more resources in the future for people with sarcoidosis.
Yeah, so it's definitely promising, isn't it? So that would be kind of a bit of light at the end of the tunnel and something positive to come out of all of this. So just going back to the long COVID then, in terms of the symptoms and things, do you have any idea about how many people are actually experiencing those prolonged symptoms who do contract the virus, whether they have sarcoidosis and other diseases or not? Is it quite a small percentage? Is it minority?
I haven't looked at the data recently, and my understanding is it was something like 1 in 20 people who had COVID went on to experience prolonged symptoms for at least 6 weeks or so. Now, some of them then after 6 to 12 weeks get better, but obviously we hear in the news about some people who've had, much more prolonged illnesses who are still very unwell, having contracted the disease in March or April of this year. So there's obviously a subset for whom it goes on longer. There aren't any data to suggest that sarcoidosis patients are more susceptible. And in fact, there's no signal really to say that sarcoidosis patients do worse than particularly do worse. But those are the data we have at the moment. What I don't think I've seen is a breakdown of long COVID in terms of age. There is I think it's a feeling sometimes it's young people are particularly prone, but that may just be because they're the ones that recover. It'll be biased depending on if you look at COVID in older people are more likely to die, younger people are more likely to survive. So it may just be biased in that sense. I don't think we can say much more at the moment.
Yeah, no, of course, yeah. Perfect. So we've also had a couple of kind of phone calls and questions come in, both via email and phone call, as I said, just a bit more around returning to work or kind of that setup and things. And just, I think a lot of people find that their employer might not understand sarcoidosis fully, and therefore they're not in a position to really understand their need to shield. So if you do find yourself in that position and you kind of need some more information to provide to your employer, we have some really useful leaflets. You can find them available on our website. You can download them as a PDF, or if you would like hard copies, then they are available to purchase in the shop as well. And we've got one specifically outlined to kind of employers that explain sarcoidosis, because obviously a lot of people have never heard of it, have they? And it's something obviously that we're seeking to raise awareness of through the work that we're doing. So yes, if you find yourself in that position, then do definitely take a look at that leaflet. And there are others around sarcoidosis and how it affects different parts of the body. So definitely worth taking a look at that if you find yourself having a bit of trouble with your employer and they just need that bit of enhanced understanding. So moving on then, we've had a question from Gareth on Facebook. Thank you, Gareth, for commenting. He says, I really believe in vitamin D and that it can help to protect our body and lungs. If my blood tests show that I am normal, would you suggest that I'm okay to take this?
Yes, that's another good question. The tricky thing is that in some people with active sarcoidosis, they will produce more of the active vitamin D. And that is not normally measured by routine laboratory assays. And when you produce a lot of active vitamin D, it suppresses production of the precursor, or the vitamin D precursor, which is what most routine laboratory assays measure. So when your GP measures your vitamin D, they're measuring the inactive vitamin D, not the active vitamin D. And every now and then I see patients who've been taking vitamin D supplements who end up with high calcium levels and quite unwell because of this. There are some centres that will measure the active vitamin D level, but not all, and it's not routinely measured. So I always caution against taking vitamin D unless you've either had the active vitamin D level measured, or your GP can measure calcium levels every 12 weeks or so. And they may be reluctant to do that in the current climate, because that's quite a lot of resource. That's 4 blood tests a year.
Yeah.
For somebody to take vitamin D supplements. So I think it's a tricky one. I think you have to be quite careful. It may be very reasonable to think about other ways of supplementing your vitamin D. It is quite difficult to get it through diet, but oily fish and eggs are a good source.
Yeah, of course, and we have actually got some more information around kind of vitamin D and calcium on our website as well, which could be quite useful. As you said, it's tricky, isn't it, to get that balance, and you wouldn't want to do anything that's going to offset your kind of vitamin D levels. So perhaps best to act on the side of caution at the moment, and then possibly a discussion to have with a medical professional when we have the availability to be able to do so again. Perfect. So just around kind of the exercise point of things now with shielding, unlike before, shielders are now allowed to go out to exercise. Obviously, as we've spoken about, this could actually really have a great correlation between exercise and mental health. It can really help things. In your professional medical point of view, would you say it is kind of worth the risk as such with going outside? Would you say that outweighs the potential risk that you might have when exercising outdoors and experiencing contact with others?
Yes, I would. You'll recall during the summer we had very busy streets, and we didn't see outdoors. We didn't see huge levels of COVID. That may be something to do with warmer weather, but it does seem that being outside is a good thing. I think if you're outside and you find yourself in a crowded space for whatever, whether it's a park and suddenly everybody's decided to flock to the park at the same time because the sun's shining, have a mask. So you can always wear a mask and you can exercise wearing a mask. That's not going to stop you or injure you or harm you in any way. So if you feel more comfortable, if you feel you can't keep 2 meters from people, or you're worried that people may not respect your distance, then definitely wear a mask. But I do think the benefits of getting out outweigh the risks, providing you can observe that. There's the mental health effects, which you've discussed. So getting out, particularly at lunchtime when the sun's out, if you can, getting some light, because it will help you sleep later on. And just getting out into nature, if you can, is really good for your mental health. But also physically, it's really good. Because there's a real risk if people stay indoors for prolonged periods of time that they'll get more deconditioned, they'll lose muscle, they'll lose fitness, and then they'll find that hard to regain later on. So even if it's just some brisk walks, I definitely say, yes, do that. There's a caution, of course, for people who are suffering from severe fatigue. In that case, you really need to pace yourself and not decide to go off for a 15-mile hike one day, because you'll probably pay for it hugely for the next 3 days. So it may be worth getting an exercise meter or Fitbit or something and using that just to pace yourself, so you know roughly how much you do every day, and you can build it up if you feel able to.
Of course, yeah. I think, as you said, it is really important to just kind of keep active and fit and healthy during this time as best as one is able to do, depending on your own individual circumstances and what you feel up to. But it definitely is a good idea, as you said, to just, if at all possible, to get out and get some fresh air, because both the health benefits and the mental health benefits can really be great. So, yeah, thank you so much for answering those. We just also had a couple of questions more around the virus and how many patients with sarcoidosis. I'm not sure if this is kind of figures that you've been exposed to, but we just kind of want to get an indication of how many people with sarcoidosis are actually catching the virus. As you mentioned earlier, you don't believe that people who have sarcoidosis are more susceptible as such. It might be more that there's just the impacts that they have if they were to catch it are more severe. Is it still the case that we don't quite know yet how many people with sarcoidosis are catching it?
Yes, I think that's right. I mean, there is a signal that people with interstitial or diffuse lung disease are more at risk of an adverse outcome with COVID, but that seems to be particularly true for patients with idiopathic pulmonary fibrosis or IPF. And the numbers with sarcoid are still too small, really, to draw any conclusions. I've certainly got anecdotal evidence from my own clinic. I've had 1 or 2 people with sarcoid who've caught COVID and recovered and who are doing very well. So that's encouraging, but of course they're small numbers.
Of course, yes. So if in the unfortunate instance that someone with sarcoidosis was to catch COVID and they are currently shielding, what would you suggest the steps they take in order to get a test, and what kind of steps do you suggest that they go through in that position?
Well, obviously they can go onto the government.uk website. So that's the recommended way to get a test. And that's probably the best way. The other thing, of course, you could do is you could download the COVID-19 symptom tracker app, which is powered by Zoe and run from King's College by Tim Spector. Some of you may have seen him on your TV screens. And they're doing a sort of population-wide study of COVID symptoms. They've got over 4 million people signed up. You log your health once a day. And that also gives you an opportunity to get tested if you need it. Although if you have symptoms, I believe they also direct you to the gov.uk website. So it's probably fairly similar at the end of the day.
Okay, yeah, regardless of whether one is shielding or not.
Yes.
Yeah. Okay. Well, thank you so much for answering these questions today. It's been greatly appreciated by everyone watching, and Karis on Facebook has sent a lovely comment saying some great questions and the answers have been really helpful. Always enjoying these Q&A sessions. So thank you so much for joining us today, Robina, and answering the questions. I'm sure that we will probably do more in the future. And of course, if there are more COVID updates in the coming months, we will be responding to them as they come in and trying to deal with any future questions that you might have as well. So thank you so much for answering that today. I'll just once again highlight, as I did at the beginning of the video, if people hadn't had the chance to join yet, that we are extremely kind of grateful for any donations that we receive at the moment. It's been very difficult for the whole charity sector during COVID times, and we're in the same boat of not being able to do live events. So if you are able to donate at all, the link to do so is in the comments section. We'd be extremely grateful, and it will allow us to continue doing videos like these. So that would be really appreciated if you're able to donate any amount to Sarcoidosis UK. But I think that just leaves me to say thank you so much for joining. As I said, it's so thoroughly appreciated. We're extremely grateful, and it's been really insightful. And I hope everyone watching has now got a bit of a clearer picture about the current shielding guidelines, what to expect over the coming month, and just got some kind of useful tips for how to deal with shielding at the moment. So thank you so much, Robina.
Thank you, Charlene. It was a great pleasure.
Yeah, thank you.
Very enjoyable as ever. Thank you.
Perfect. Well, thanks everyone for watching. See you next time. We'll be promoting future Q&As on our Facebook page, so be sure to join in. And thank you so much for watching. Bye-bye.